when we started to work in public health that this is what we signed up for.
It takes a lot of work to keep COVID vaccine centers running and running smoothly. Ashley Sampson takes us behind the scenes at one that has been successful.
Welcome to a retail experience unlike any you've ever had.
Pull out your photo ID and head.
Gone are the clothes and shoes and shelving.
Allergies to any medication.
And here to stay are doctors, nurses, and even members of the military.
They can look you up in the system.
No more sales happening here, just shots.
You're all done, okay?
Lots and lots of them.
It really was a surprise to us that we were in a, that here we find ourselves in a former retail establishment, giving vaccinations.
This is a mass vaccination site in Spanish Fork, Utah.
Neither of you guys have had COVID in the last 90 days?
When the Utah County Health Department learned they would be responsible for administering the vaccines, they got to work.
We've kind of been planning for this day for a long time, but when it's here, the sheer reality of needing to do this amount is shocking.
Today, those 70 and older are receiving their first dose of the COVID-19 vaccine.
We've been waiting 10 months for this, and it's a miracle that it's here this soon.
I'm relieved. It takes a little bit of stress off of you to know that there's help on the way.
Do we need more registration people?
Tyler Plew is with the health department.
I work in environmental health, so we work with restaurant inspections, we do septic system installations, we do pools. How are you guys doing? Everything go okay?
These days, it's less about the pools and more about the people.
We try to get people in and out in about 30 to 40 minutes.
So far, the county health department has administered close to 30,000 doses. But perhaps their biggest accomplishment so far,
we are not wasting one dose. If we have 4 extra doses that are drawn and our clinic is closed, we have a list where we call people.
Not one dose has gone to waste. The people with the health department say it's the advanced planning and community support they have to thank.
We found that so many people want to help, and let's utilize them.
Like retired Dr. David Lind, who is once again wearing his white coat.
Just want you to relax your arm and let it rest on my knee there.
The governor also activated the National Guard to move things along.
We see a lot of veterans here. It's actually quite fun to interact with everyone.
The work here is not done, not even close.
We need to be ready. We can't react. We need to be ahead of the curve.
In the coming weeks, more and more people will be eligible to get vaccinated, meaning more sites like this could be popping up in your neighborhood.
We're happy to be here. We've got a lot of space, and we're going strong every day.
I'm Ashley Sampson reporting.
Thank you for joining us this week for our look at the latest in COVID-19 treatments. Join us next week. We're telling stories about race relations in America right now, where things stand, and the changes this year could bring. Until then, from Kingman, Arizona, I'm Chris Stewart, and this is The Race.